The private practice section was formed in 1955, which was about 34 years after the American Physical Therapy Association was formed. It was actually formed at that time under the name the self-employed section. Those at that time were actually primarily women. In the early days, there was actually some stigma about physical therapists being business owners. The profession had been formed at the end of World War I as Reconstruction aides came together to continue the work that they had started during that time. And they treated polio victims as well as casualties of war. And so this idea of going from treating these populations and essentially providing service to them to the concept that you could do this as a business was difficult for some members to reconcile. The section's purpose is to champion the success of the physical therapist in business. We advocate for fair and equitable reimbursement and payment, both for physical therapists and to benefit their patients. We provide education on all aspects of running a physical therapy outpatient practice, and we connect members with other practice owners to help them build their community and find resources and build friendships. PPS relies on its volunteers for most of the content that we put out for our members. We provide marketing education for our members. We provide advocacy as well as education on payment and on best practices in physical therapy. And none of this work could be accomplished without all of our committee members who serve the association every year. The COVID pandemic really brought a lot of this to the forefront.
Being a PT at the beginning of the COVID-19 pandemic was definitely a scary time for so many of us. Our section is made up of people who own their own businesses, so we were watching our livelihoods change dramatically. We were worried not only about taking care of our patients, but also our staff.
We formed the COVID Advisory Committee to work very quickly to put material together and disseminate it to our members. At this time, information was changing on an almost daily basis. Sometimes the laws were passed and regulations were a week behind that, so it was a matter of interpreting for our members what we knew and what we didn't know, and helping them to understand all of these various regulations that were coming out and how they would impact their businesses.
The COVID Advisory Committee was created to represent a broad variety of practice sizes, geography, locations, and skills and expertise that our members needed.
These members came together during a time that really for each of them personally and in their businesses was extraordinarily difficult. Each of them was dealing with how to keep their own practices running and how to keep their staff members and their patients safe. And at the same time they were working through that, they were spending countless hours putting together resources and sharing what they learned with all of the PPS members.
Our membership really, I think they found hope with the content we created and with the online meetings that we had. And I think that in a time that was really dark, there was a lot of hope amongst our profession and specifically our membership that there would be brighter days ahead. Early on in the pandemic, many business owners were concerned if they should keep their doors open or not and what was safe to do. The Department of Homeland Security released a statement that stated physical therapists were essential healthcare workers, and this guided a lot of our actions from that point forward. Providing our members with good guidelines on how to do that safely was really important. As the pandemic progressed on, the other role that we assumed was that of a primary care provider. People didn't want to go to their doctor's offices. They didn't want to go to the ERs. And so pain management and direct primary care services became critical at our outpatient facilities. And we believe it really kept a lot of people healthy and also took the strain off of our hospital systems when they needed us to be there. I remember one patient in particular called, and he was a construction worker, so his job was essential, and he was injured on a job. And he had a hard time finding a clinic that he could get into and someone that would see him. And we were really proud to be open at that time to help not only that individual patient, but his family and our community as a whole. During the pandemic, PPS really served as the central hub and the engine. But nothing really would have happened without our volunteer members. And from the COVID Advisory Committee to their colleagues, we were producing webinars and articles and content weekly, sometimes daily, to serve our membership. And none of that would have been possible without the people of the section who raised their hands and gave back at a time when their fellow physical therapists really needed them the most.
I think as a section, we can't be grateful enough for the work that these individuals did on behalf of other members.